Welcome to another episode of MedMadness, where we delve into critical medical topics to help you succeed in your studies and clinical practice. Today, we're discussing fetal alcohol syndrome, or FAS, a condition resulting from prenatal alcohol exposure that has profound and lasting effects on a child's development. FAS is characterized by a range of symptoms, from behavioral difficulties such as distractibility and emotional reactivity to physical features like facial anomalies and growth retardation. The impact of alcohol on the developing brain can lead to significant neurobehavioral challenges, including intellectual disability, inattention, and social skill deficits. Understanding these features is crucial for early diagnosis and intervention. Next, let's discuss fetal alcohol syndrome in more detail. FAS is a preventable condition that arises when a mother consumes alcohol during pregnancy. The developing fetus is particularly vulnerable to alcohol's harmful effects, which can result in a variety of structural and functional abnormalities. Children with FAS often display behavioral difficulties such as distractibility and emotional reactivity. They may also struggle with intellectual disabilities, attention deficits, and social skill challenges. These issues are linked to structural changes in the brain, including deficits in the corpus callosum, cerebellum, and basal ganglia. These brain areas are responsible for coordination, reflexes, and executive functions, leading to difficulties in writing, clumsiness, and challenges in impulse control. Moving on to physical and growth features, FAS is also characterized by distinctive facial features, including short palpebral fissures, a thin upper lip, and a smooth philtrum. Growth retardation, both before and after birth, is another hallmark of the syndrome. These physical signs, combined with the behavioral and neurological symptoms, help clinicians diagnose FAS early. Next, let's explore the mechanism of injury. The harmful effects of alcohol on the fetus are primarily due to the inhibition of NMDA receptors and hyperactivation of GABA receptors in the brain. This disruption affects the development of critical brain structures and functions, leading to the neurobehavioral challenges observed in FAS. Now, let's consider a real-life case study. Imagine a 6-year-old boy, James, who was brought to the clinic by his foster parents due to concerns about his behavior and learning difficulties. James had been struggling in school, often getting distracted and unable to complete tasks. His teachers noticed that he had trouble socializing with other children and was often emotionally reactive. On physical examination, James exhibited the characteristic facial features of FAS, including short palpebral fissures, a thin upper lip, and a smooth philtrum. Further assessment revealed that James had difficulty with writing and coordination, common in children with FAS due to the impact on the corpus callosum and basal ganglia. A detailed history from his foster parents revealed that James's biological mother had consumed alcohol heavily during pregnancy. This information, combined with the clinical findings, led to a diagnosis of fetal alcohol syndrome. To wrap up, fetal alcohol syndrome is a complex condition with significant implications for a child's development and quality of life. It's essential to recognize the signs early and provide appropriate interventions to help these children achieve their full potential.